All right, we got a piriformis problem, but we need to figure out what's the deal. Let's do a quick internal rotation test here. We're looking for either excessive motion or limited motion. My affected side is the left side here, so it looks like I got a little bit more on that side, which would mean that my piriformis isn't short and tight, it's long. Could be long and pulled taut, creating an issue, but in that situation, we want to either strengthen it or we want to create some more stability for the hip so the piriformis isn't kind of having that tension constantly pulled within it. So we'll start with some lock clams there. Those are easy little micro movement clams. Then we jump right into a hip neutral glute activation here. Just little pumps from that position. Then we can go into like an abduction kind of assisted, or I guess resisted, banded hip thrust here. Then we can go into like a banded box squat. Again, we're just kind of putting tension on that band. And by doing that and going through these motions, activating the glutes, it's going to activate that piriformis. We got some monster walks here, classic monster walk. You want to be careful about how you're sliding those feet. You don't want to lift the foot and put it back down. That's going to stimulate the TFL. And we want to make sure that we're just using the glute. Now we've got a plank with abduction, or kind of a plank and clam at the same time. It's going to kind of integrate the core and the hip musculature, external rotators, abductors, glute medius, some of the piriformis and all that. Here's the back side here. So it's just a plank from a knee position up into a clam at the same time. This takes a little practice to get used to it. All right, so now if our piriformis is short, we probably want to loosen that thing up. Probably want to do some muscle work. You know, even with a long piriformis, you could do some muscle work, but you don't want to stretch it, you know. But with a short one, you could stretch it. And some good old foam rolling helps kind of create some pliability in the tissue. And then you can go into that kind of that classic figure 4 seated stretch, but you don't want to hunch the back too much. It's just not a good habit to get into. So here's the side view. You can see my back's a little rounded there, but you want to stay pretty upright. All right, but with a short piriformis, after we restored that mobility, we got to address why it got tight, right? So it's probably inhibited glutes, so it'd be good to go back and do some of the same things that you did with the long version to kind of help lock in this kind of correction. So piriformis, that's it.